Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred. Joining us on today's episode is Dr. Deanna Blanchard, a board-certified family medicine physician and certified culinary medicine specialist from Terrebonne General Multispecialty Clinic in Gray. Welcome to the show, Dr. Blanchard.
Thank you for having me.
I'm so glad you could be with us today. Why don't you tell the audience a little bit more about yourself and what you do at Terrebonne General?
I'm family medicine, so I see adult patients with chronic conditions, preventative care. My passion is really lifestyle medicine and food and fitness as best I can.
How to fit all that together,
Yes.
right?
Yeah.
All right, well, let's jump into today's conversation about how you help patients lead healthier, more productive lives.
So I think, hospital, we see a lot of chronic care management patients, so patients coming in with chronic conditions. And I often see patients who really want to make health changes. So it's starting with where a patient is today, whether it's dealing with a disease process and coming out of the hospital, or whether it's, I'm here because I just want to be healthier. So I think we kind of see the spectrum, and I try to collaborate with a patient on where they are now and where they want to be, and we try to find how we get there.
What does evidence-based medicine mean in layman's terms?
Yeah, that's
and
a
why
great
is it
question.
important?
So evidence-based medicine is really using research, FDA-approved medications, the most recent research, hopefully, to decide on treatment plans and what's going to be best moving forward for a patient's condition.
And how does balanced medical research, how do you balance the medical research component with the individual patient needs?
Yes, that's a great question, because oftentimes our care is dependent on patient affordability, insurance reimbursements. So sometimes the most recent research and evidence and some wonderful medications we have these days are not always preferred or cost effective for a patient. So we kind of have to meet patients where they are, and we have the conversation about what's available and what their needs and wants are, and then we try to meet with what we can get covered, if that makes sense.
What works best for them.
Yes, correct.
What are the most common chronic illnesses that you treat?
So I would say probably the most common processes across all of primary care is going to be, so our number one condition is cardiovascular issues, right? So for us in primary care, many of my patients are dealing with either pre-hypertension or hypertension, diabetes or pre-diabetes, obesity, and overweight. They came out with the new dietary guidelines last year, and I was really shocked to see the secretary's letter that said 70% of Americans are either overweight or obese. So it's
Very high.
very high. And 90% of our healthcare costs are going toward patients who have these chronic conditions. So addressing that is really vital to our system and to our individual health, and to really patient outcomes and quality of life, I think.
That's what's going to be my next question. Why is addressing things like hypertension, obesity, and diabetes so important?
Yeah, so I think part of it comes down to, for me, when I talk to a patient, part of it is quality of life. If I hear one thing from many of my patients with chronic disease processes, or those that are embarking on a new diagnosis, they want less medicine. And so it's trying to work with them to figure out how can we treat these conditions or prevent what's coming in the best way possible that's safe, and also reducing medicines as best we can.
Right. You touched on it a little bit, but how do you help patients who have chronic illnesses, and how do you help them overcome these chronic illnesses?
I think it depends on where the patient is in the process. Some patients have been dealing with, say, diabetes for a very long time. We are very fortunate here at Terrebonne General because we have a very healthy support system.
Mhm.
So I really lean on our dietitians, our registered dietitians. Sometimes we have a wonderful diabetes educator here. So that's one of the first places I start if I see a patient who is maybe struggling to keep their A1C in control and we've kind of exhausted affordable medications. I get back to basics. Like, let's talk about what you're eating. Let's get in with a dietitian and kind of go back to kind of what puts us in these chronic conditions sometimes, which is what
Mhm.
we're eating, how much we're moving. So thankfully, we have a good support system for some of that.
Yeah, and we are very lucky.
Yes.
So let's get into what is lifestyle medicine and how is it different from traditional care?
I look at it more as a kind of a co-therapy, right? So
Mhm.
again, depending on where a patient is in a process. So if they're pre-hypertension or pre-diabetes, nutrition, movement, all of that plays a vital role in potentially preventing a disease from development. In patients who are already living it and maybe on multiple medications, lifestyle is kind of more I would say a co-therapy. So it's not
Mhm.
necessarily to replace in
Mhm.
those patient populations as much as it is to enhance their health. And in some cases, eventually, once the lifestyle is there, and it's foundational, I guess, once that is established and we can make it sustainable, sometimes we start pulling away medications, which is a success
Okay.
for many patients.
Mhm.
They love to see that happen.
So how does lifestyle medicine enhance?
So sometimes with nutritional changes, for example, right now we've just started a new medical fitness program with
Mhm.
Terrebonne. It's called You Thrive. So our first cohort was patients with hypertension. So they're meeting with our dietitians, and then we get them set up with a program in fitness. We know that evidence shows that DASH nutrition, so dietary approaches to stop hypertension, sometimes reduction in sodium, eating more whole foods, less processed foods, we can sometimes see a 10-point reduction in high blood pressure. So, along with exercise, which we can also see a reduction in blood pressure,
Mhm.
those are lifestyle management options that can help a chronic condition. So we work with the program and then frequent follow-up for most of us to see if we can kind of work with reduction of medicine along with those lifestyle changes.
Right. And how can these small changes make a big difference?
So a good example, I use this one a lot for, say I see a patient who is, we check an A1C. So an A1C between 5.7 and 6.4 is considered pre-diabetes. So sometimes if I see a patient in that range, we talk about lifestyle first. What are you eating? Are you moving? What's
Mhm.
your environment like? Do you have time to exercise? One small change that I can make with some patients is if they're drinking a lot of soft drinks or sugary drinks, that's the first thing, small thing. If they say they're willing, I could stop drinking Coke or I can stop drinking juice. I
Mhm.
oftentimes will see if we take that away and they replace it with water, we can see sometimes that resolve. So that small thing can make a huge difference.
Can you use food as medicine?
I'm going to say yes, but I say that carefully because we also have to look at chronic conditions. That's where our registered dietitians come in. So
Mhm.
if a patient has chronic kidney disease or they're on a lot of medications, we really have to weigh what foods we're encouraging them to eat, protein intake in a patient with chronic kidney disease, we have to be cautious with that.
Mm.
For the most part, we are encouraging healthy protein intake, but we really have to look at each individual patient to kind of cater to their life, their medications, their chronic conditions. But
Right.
yes, I think the right foods definitely enhance and can treat.
Well, that's wonderful. The right amount of macros have to go with it, right?
Yes, I think that's a big topic right now with so many patients on
Yes.
GLP-1 medications. We're really kind of holding on to protein intake with those patients. So,
Do you have any nutritional tips, like a simple nutrition tip that you can give us right now to how what people can incorporate into their daily lives?
yes, so our big push right now in nutrition is trying to reduce processed and especially ultra processed foods.
Mhm.
So I think, and this was part of the new dietary guidelines as well, is just trying to eat more whole foods.
Mhm.
So the less processed, the better. So if it's minimally processed, and so trying to get back to the kitchen, grocery shopping, and eating real food, I think is
Yeah.
probably a simple start.
Fruits and vegetables, but
Yes,
not
and
canned as
proteins.
much.
Yeah, so canned is probably better than a bag that's highly processed. I usually encourage one simple thing I encourage for patients that's practical is when they're grocery shopping, grocery shop on the outside of the store because that's usually where the fresh foods are. So if
Mhm.
if it's going to go bad within a week or so, it's probably good for you. And those middle
Right.
aisles are kind of where the highly processed foods sit. And if it can sit on your shelf for months at a time, it's probably not the best for you. But
Right.
you gotta weigh it, and we have to
Yeah.
meet patients where they are. So, for example, if they live in a rural area, sometimes they have to buy foods that will last a while
Because they don't go to the
because they're
store as
not going
much.
to the store as much. So
Mhm.
we have to kind of look at all that and each person as an individual and what their environment is like.
So how can these small changes have a big impact on your health?
Yeah, so I think small changes over time is really where we see the benefit because
Mhm.
w- larger changes that happen fast are sometimes not sustainable, right? So
Mhm.
what we're
Mhm.
looking for are long-term sustainable changes that are going to work for a patient long term.
Mhm.
So sometimes a small change, a little bit at a time, um, they make a change, say cutting out soft drinks, and over
Mhm.
time, they don't really miss it anymore. And so that change has happened, and they usually are not going to go back to it. And then we work on the next thing, like how can
Right.
we incorporate more fruits and vegetables, or what does your protein intake look like? So we
Right.
do kind of one thing at a time, and
Mhm.
hopefully all those small changes add up to really big changes over a period of time.
So baby steps.
Yes, baby steps that we can sustain.
Well, thank you so much for sharing this helpful information today. We
Yeah,
appreciate it.
thank you for having me.
For more information about Dr. Deanna Blanchard, visit tghealth.net. Thanks so much for joining us, and don't forget to like, share, and subscribe to our podcast where you get your podcasts.